Hi, Sue.
Hey,
Glad you could join us.
I'm happy to see everybody who was on the attendee list. Great to see a few names I recognized.
Hi, Frank and Emily.
It is so fun to see everybody.
I know, it really, it's a nice mosaic. So those of you who don't have your cameras turned on, don't be shy.
That's right. This is a judgment-free zone.
Exactly. Everybody looks wonderful. I did an all-staff meeting earlier this week, and we had a segment for assistants to be introduced, and the assistants were two-legged and four-legged.
Oh, there you go.
And
when
people
I
had fun showing
when
them.
I do mine at home, one of my dogs has to be on my lap at all times. So, so it's hard whenever I'm like typing at the same time, because sometimes I'm taking notes and he just puts his head right on the keyboard and it's like, this is not helpful. I have to do work while we're doing this.
This is Ellen Kitchen from California. I have a question. I'm trying to turn on my video, but it says you cannot start your video because the host has disabled it.
Well, that's a dilemma.
Yeah.
So who is the actual host, Jolie? Is it Matt?
It is.
Okay, I just got a question.
We can see you, Ellen.
Should
Yep,
be good
you're
now.
on
See you
now.
now, yes.
And Ellen, Jack Schottmiller's on
Can't see
too. He's
myself.
coming on. Hi, Jack.
Hey, Jack, how are you?
Okay, here.
Nice. Okay. Maybe someone just fixed.
So it is, oh, there's, see, somebody has their assistant there. Mary Ann has hers.
Hi, Kathy Plum.
Hello.
Oh, yeah.
Hey. Looks like Jack's trying to connect to audio. We're all learning how to do these the new technologies in a wide variety of ways.
That's for sure.
And except that we don't look great on most of them.
Oh,
Right. Well, I don't know if some of you might remember Kathleen King. She was one of our tenured faculty of a few years back, and she was actually just elected to the medical center board, and so she was on their first meeting we had. And so I've learned how to do the chat feature, and so I had sent her a private message through the chat saying it was good to see her. I was really glad that she was a member of the board now, and she didn't reply back. And so then the next day she emailed me and she said, I had no idea how to reply to your chat. I saw it. She said, nor did I know how to turn off the video. She said, so I have to get some education before I come back on. So.
Switch chairs.
Well, Jessica or Jolie or Kathy, just let me know when you want to start.
I would say we probably should get started since it is a little after 3.
Okay. Well, welcome everyone to the conversation with the Dean, Kathy Rideout. Thank you, Kathy, for clearing your calendar this afternoon for us. I want to say that it's a pleasure to have the opportunity to be the host. Some of you may not know who I am. I'll just tell you real quick. I was born in, no, I'm not going to do that. I'm a graduate of the School of Nursing in the Adult Primary Care program of 1985. It seems only yesterday. And I was back at the U of R for the first time a year and a half ago. And I'm currently employed, and I work for an organization that supports clinical research. And I'm a vice president and director of clinical trials. So all this COVID news, we're supporting several studies, and it's unfortunate that we have this pandemic, but it also, as a researcher, and I'm sure many of you can relate, and as a scientist, it's pretty exciting, and it's exciting and scary at the same time. So I want to just go through a few technical reminders. I'm not going to show you where the bathroom is because I assume you know where where you are should you need it. And feel free to get up, or if you need a drink of water or something. But the session will be recorded, and so if you would prefer not to be recorded, please, you'll have to disable and listen to the recording afterwards. And Matt, confirm for me, we are also showing people's faces. Is that correct? I can't remember. Yep. Okay, so again, we certainly understand, as we started out to say, this is a no judgment zone. So if you prefer not to have your voice potentially be recorded, or your picture, and you can always disable your video cam if you don't want to have your picture, but we would encourage you to participate. There will be time for some question answers at the end. You can raise your hand. Those of you who aren't having a visual, there's an icon, I believe, or you can use the chat feature, which is at the bottom right, I believe. You know, at the bottom you have the toolbar, and there's a little icon that says chat, and you can type something in, and someone, I don't remember who, is going to be monitoring those for us. So I think that is all of the details that I have. And so again, I'd like to welcome you. Thank you for taking time out of your busy days, because I'm sure you have a lot going on. And I happen to be in the Maryland area, and we have people from Massachusetts. If you're from Massachusetts, raise your hand or clap or something, and so we can see you. And some of you are from California, Texas, New Jersey, and then of course Rochester, Rachacha, as I like to say. So welcome. And Kathy, again, welcome to you. I know you have been really busy, and I think it's so admirable with the how the School of Nursing has reached out and supported our colleagues who are on the front lines. And also, I'm sure for you, it's been gratifying to have nurses really get the recognition that they so well deserved, and in so many different venue or clinical areas, that it's really refreshing to see. And I think we are, I mean, people, I'm sure you've experienced, when they hear you're a nurse, they're like, oh, you're a nurse, and then they're, you know, very complimentary, but to hear that from, you know, national figures is really rewarding. Kathy has, as you probably are aware, has served in the nursing community for more than 30 years. She's been a nurse practitioner, a teacher, scholar, and administrator. And she's led the school in diversity and wellness, the initiative that's about 2.5 years old, and still continues to work as a pediatric advanced practice nurse at the Children's Hospital there in Rochester. And I always tell her she's not your typical dean, which I find very refreshing. She's very approachable and personable, and I'm sure you have found that to be true as well. So thank you again for taking time, but also, as importantly, thank you to all of you who are joining us today. And I'm sure you'll find this a very invigorating conversation, and we'll probably learn some and get some updates as to what's going on, not only within the School of Nursing, but how we're reaching out into the world. And so I'll stop there to ask if anybody has any questions. And I'm going to kind of be like Oprah or Kelly, not to sing.
So I just wanted to thank everyone for joining us today too, because, and this is meant to be really a conversation. We'll share with you some of the things that have been happening, but first I do want to just, thank Nancy for not only is she an alumni and has an amazing career, but she's also a wonderful donor to the School of Nursing for scholarships for our students. And so I'm forever grateful for her
Thank you.
for that investment in the future generation. And so, definitely thank you, Nancy. And we were reminiscing that we were supposed to have dinner in March. When I go to DC often, and I try to link with Nancy when we get to DC, and I said, looking back on that, it was a tough decision. Should I go to DC? Should I not go to DC? And my husband was saying, I don't think it would be safe for us to be on an airplane. And now that seems like such a silly conversation we even need to have, because the world completely changed in such a short period of time. And I'll just share with you a couple things, and we'll open up to questions. But when everything started to unfold, and we began to realize that things needed to change, and our students were on break at that time. And so they were on spring break for that week. And because, our students come from all across the country, particularly for our accelerated program, our other students in the RN-to-BS program or in our master's programs are fairly local. But our accelerated program students, they're from all over the country, and some that are international. And so a large number of them actually went away for spring break. And so there was a university-wide decision that we would take a pause for 1 week after spring break so that we could recoup and really begin to think about how we were going to deliver education. And we really very quickly made a decision that we couldn't bring students back, that it was not safe for the students to return. And the same thing happened, River Camp, it was a much bigger issue because it's a residential campus, right? But we had to make a decision pretty quickly that we needed to switch to fully online learning. The hospitals were trying their best to make decisions about whether it was safe for students to be in the hospital. Because at that time, Rochester wasn't seeing the hotspot issues that New York City was, but we needed to be prepared. And so, all the planning for a surge capacity needed to take place in the development of a COVID-19 unit, and where they were actually calling the highly infectious disease unit, and really putting those plans into place, and whether it was going to be safe for students. And so the hospital systems made a decision that they would focus clinical placements just on those that were going to be graduating in May, so that they could really get all of their clinical experiences they needed to be able to graduate. So that was the focus and the commitment, which was fantastic for us, but also much more fantastic for the students. And so that's where they put their focus. And so we as chairs and deans of schools of nursing in New York State, New York State Department of Education sent us a template of what information they needed to have to approve any change in what clinical placements would look like, how we were going to substitute it with any experiential learning or simulated learning. And we quickly completed that information. And unlike New York State and any other thing, they approved our plans in 24 hours.
Wow.
And we were all shocked by that, but they knew the intensity of which we needed to work. And so in a very short period of time, we converted all of our classroom didactic learning to either synchronous sessions or asynchronous sessions that included simulated learning, virtual learning techniques. And Michelle Roach is on the call somewhere. I saw her somewhere along the way, and she was in, she's one of our pediatric instructors. And so, we fortunately had already had an infrastructure for such, right? Because our psych mental health program is fully online. Our RN2BS program is fully online. We already have an instructional design specialist team. And so we were already had the infrastructure to be able to do it. Doesn't mean it took any less time for us to do it, because it was very time intensive for courses that we didn't have it, particularly for our accelerated program, but we needed to do that very quickly. And our students that were away just never came back. They stayed in California and New York City and Massachusetts, wherever they were. They just stayed where they were, and then they participated in the coursework as we had designed it. So our accelerated students that will graduate in May will graduate. Our nurse practitioner students will graduate. There was a focus locally to get them what they needed to have. Some of those students were actually in the military and were deployed to other areas. And so we made an executive decision to count that as their clinical. that as far as we're concerned, that counts as their capstone experiences. So our initial focus had to be on the students that were graduating. And then we made a decision very early. And I think there was some divine intervention in that wisdom, that we would not admit our May cohort of our accelerated students. And that decision was made very early. Part of it was because half those students do not live in Rochester, and we're already questioning if they were going to be allowed to come, how they were going to get there, whether it was going to be safe to fly. And so in March, we made the decision not to admit the May cohort. And so what we did with them is I sent them a video message telling them it was a hard decision, but that we would bring them back. They could defer to either September or January, or make a decision not to come at this point in time. And so the majority of them are coming in September. And then the rest are coming in January. We only had a couple that said right now their financial status was not stable, and they didn't know what it would be like really for tuition. And so instead of admitting 65 students in September, we decided to admit 80. However, that meant that of the 400 applicants we had for September, we could only admit 25. Wow. So that's tough. That's really tough. And for the healthcare system, I had to let them know that come May we wouldn't have any graduates because we weren't bringing in that group. So it was really had a domino effect financially, obviously for the School of Nursing, but even more importantly, personally for those that were hoping to start in May, but then for our clinical partners not having those graduates. So that was a tough decision. And then deciding that we couldn't hold graduation because we weren't going to be able to do that. And so we'll have a virtual graduation next Friday at the same time as what was planned for them to be in person. And then within a week of everything happening, the chief nurse executive, Karen Davis, for the hospital system, and she oversees all the affiliated hospitals in addition to Strong. She had talked with me about the need to possibly bring back nurses that had already retired or who had left the profession for a short period of time, and that she needed an RN refresher course. And she said, could your faculty develop that? And we knew that would be a heavy lift only because they were already focusing on transitioning to all online learning. But there was a group of faculty that were part of our instructional design team that within 1 week, many, many hours a day, they devoted to developing what they called an RN reentry program. And fully online, full capacity to reach any nurse within our region, many county region, free of charge for them to take that course. And I actually don't know how many have enrolled in that, but that was also pretty significant. And then the final thing I'll say before we take questions is that we have a business line of employee wellness that Nancy had talked about, and so obviously our nurses. could no longer do biometric screenings for the 50 employers that we have contracts with, because there was, we weren't able to do that. And so those nurses really took over the command center for the hospital, for Strong Memorial and for FF Thompson, to be the phone call command center for when people called with questions about their health, or what, if they were having symptoms, if they were employees, or even if they weren't employees, to be able to guide them in decision making. And so because we had that infrastructure, and that was really how we do a lot of our care, is as a functional command center, they were all redeployed to those functions. And then we still were able to do our condition management programs for heart-related issues, for anxiety, for depression, all those other services that we provide to employers. We just transitioned those to all telehealth, and that those programs actually have increased. And so for each of our business lines and our research as well, we just had to make some quick decisions. I don't think I've ever made as many fast decisions that needed to be made. And fortunately, we have a great team that we work with, that we were able to do that.
Wow, it's impressive. And you forgot to mention the daycare.
Oh yes, I did. So probably within a week of us pausing and knowing that we weren't going to be able to have students in, I received a phone call from the hospital that they were looking for a site to have a child care center that would be available to healthcare workers on the front lines, that now when the city school district and Rochester closed all of their schools, that their kids needed to have some daycare so that the nurses and the other healthcare workers could be at work, and said, would you mind if we used the School of Nursing as the child care site? And that was a non-issue as far as I was concerned. I said, absolutely. We have lots of room here. We have nobody in the building, and so they really took over the 4 large classrooms that we have. They made it so that there'd be less students in each age group, and then the whole lobby where we have our student lounge was all converted to childcare. And so they have taken over our building. So they have a whole process in place. They were able by state law to really have about 45 kids at a time. And we've had a steady enrollment there of about 35, 40 kids every day.
Wow.
And so the athletic center for the hospital that we have, there's an athletic center there. They had to close, obviously, because they weren't able to continue that. And the coaches on River Campus, who no longer had students to have as sports teams, they all were redeployed to the child care center. And so we have quite an active little group of folks down there every day, and they get screened when they come in, and they have masks that they put on, and they have a lot of really fun activities. And so there's still a lot of nice laughter in the school, and so that's been good for us to be able to do.
Well, thank you. I think it really demonstrates the coming together of a community. We always knew the University of Rochester was a community and part of the greater community of Rochester, but clearly what you've just described is a real demonstration and commitment and congratulations, if there's congratulations in order, for being able to pull all that together so quickly and to meet the needs of not only the students, the patients, and the community at large. That's remarkable. So why don't we pause here and take some questions from those of you who've joined us. Again, you can raise your hand or use the chat feature. Don't be shy. Okay, Kathy Plum.
Hi, Kathy. Good to
Hi,
see
Kathy.
you. You've outlined a lot of the immediate impacts that COVID-19 has had on education and practice, but I'm wondering what your thoughts are as to the long-term or more enduring changes that this is going to cause, you know, for our profession down the line.
Yeah. And so, you know, one of the ongoing conversations and planning continues around even in the next 6 months to a year, what our educational process is going to be like. And so we are planning to bring, you know, we're planning to continue our programming in May, you know, after the graduation, the new, you know, the students will be continuing because our programs are 12-month programs. So we are going to continue those, and we'll have a lot of the didactic content front loaded for the semesters in the hopes that we'll be able to bring students back for labs beginning of July, as well as into the clinical area. And so, you know, we definitely are planning to continue our programming, you know, even in the long term. But we have to plan now for social distancing within our classrooms, and within our labs. And so it's very possible, you know, our classrooms will hold 65 to 70 students. We're not going to be able to have 65 to 70 students in a classroom. I can't even envision that for a long time. And so, you know, we will be separating them out into smaller groups. We already are measuring our classrooms to see what is the square footage around each student that we will need to have. And then obviously having, you know, PPE for our students, you know, face masks, obviously while they're here in the school, but then make sure they have available PPE to go into the personal protective equipment to go into the clinical areas. And then in the clinical areas, you know, they are committed to students. You know, fortunately, we're part of an academic medical center, and they are committed to our students being there, because this is what they're going to be doing. So in the short run, you know, we will have to change really the way that we interact with our students, and, you know, have that space around them. But when you look at the long term, thinking about changes we need to make in our curriculum, you know, the one thing that has become so clear, I mean, it was clear before, but it's even clearer now, about the need to really ensure that our students have a great understanding about the impact of any of these kind of situations on the disenfranchised. That, you know, it is, you know, when you think about the amount of poverty right now, the loss of income, all those social determinants of health, that and the mental health needs, and, you know, Kathy Plum is, you know, a mental health expert, and so I you know, I won't rely to you with this, but the mental health issues are extraordinary. And so we already have obviously a lot of content in mental health in our program, but the emphasis has to be even more on the social determinants and on mental health, because the impact is significant. You know, I will tell you that in the hospital, they had to really decrease the occupancy of all of the hospitals so that they could be prepared for the surge for COVID-19 patients. The only place, and I know this isn't going to surprise you, Kathy, that increased in occupancy was the psych mental health units, that they actually had to add beds, and they are at 108% occupancy as of today. And they converted all of their outpatient visits to telehealth, and they are almost at a 0% no-show rate. And part of it is the ability to be able to communicate by telehealth might be less, what's the word, you know, less stigmatizing than going into a psych mental health facility or to psych mental health provider. So I think we're learning a lot about how healthcare is going to need to be redesigned. You know, the numbers change all the time, but the number yesterday was that they were providing care, not just mental health, but even primary care. They were providing, you know, about 100 primary care and mental health visits telehealth a month. And last month it went to 12,000.
Oh my gosh.
And because they weren't able to bring patients into any of the outpatient facilities for any of their visits. And so they really had to convert those visits because people still have health needs to telehealth. And so we're going to have to do some education more so about how you conduct care in a telehealth framework than we ever have before. We have very little of that in our program. And I think educational programs are going to have to adjust to that. How do you conduct an interview? How do you conduct an assessment using telehealth?
Right, and as you were talking, I was thinking maybe this is going to hasten something which I've been hoping would happen in the healthcare system, which is greater integration of behavioral health into non-psychiatric settings.
Right. And the hard part is, we have some of our primary care sites that have behavioral mental health providers on site. And so trying to figure that out, how to do that by telehealth, do you sort of put someone on hold and then provide the mental health provider, or is there a way to do that as a three-way, when you're doing some sort of a visit? Our barrier right now is we need to make sure we get reimbursement at the same rate for a telehealth visit as we get for an in-person visit, because it's a needed care issue, and looking at really redesigning that. I've shared a couple different times, in the process, I needed to have a primary health, checkup because I was diagnosed with high blood pressure. I joke and I say, I don't know why I have high blood pressure now. How could that possibly happen? But I needed to have a follow-up appointment, and we did that by telehealth. And I said, for me, and having not to walk to the parking lot, get in my car, drive to my primary health office, be there 15 minutes early, have my appointment, then get back in my car. That was an hour and a half out of my day, where this was just a 10-minute telehealth visit. And so it could easily have been done that way. And so we really are exploring different ways to provide care. And we always learn something after something like this, and I think that will be very seriously considered. And so if that is, then we have to change how we educate our students, particularly our nurse practitioner students. How do you provide that in a telehealth visit? Because it'll be really a different way of providing care.
Thank you. Thank you for the question as well. Very timely. Others? Yes?
Right.
Kathy, when you talk about telehealth, how does the medical system get paid for those sessions?
Yeah, so that's a great question. So it is right now, it is at a different rate than it is for a regular in-person visit. And so they do get reimbursed from the insurance companies. And and I only recently learned this, that if it is just by phone versus by a telehealth, by actually seeing someone like we're doing right now, there's actually a different rate if it's by phone versus if it's by video. So you get less reimbursement if it's by phone than if it's by video, which is also less reimbursement than if it's in person. So, there's really conversations happening with all of our insurance providers about really re-exploring those rates, because there's obviously certain levels of care that have to be done in person. If there's a physical exam that actually has to take place versus a follow-up exam, then there's a difference in where that has to take place. And what has happened in this process, thinking about doing 10,000 of those visits, some of the providers and some of the patients didn't have video capacity. So whether it's they have older phones or a flip phone, or their computer doesn't have it, and I know this will surprise you, there then became a shortage of cameras for computers. So even if someone had the capacity to actually use a camera, even in some of our own primary care providers, in some of our rural areas, they couldn't provide telehealth by video because they didn't have cameras. So, we really have been, searching to get all the cameras that are needed as well. So there are really daily conversations that are happening with the insurance providers to ensure that there is adequate reimbursement for those visits.
And I would think also you have to be mindful of the security of the medical records. Mm-hmm. And hopefully most of them are electronic.
Right.
But even so, then having that information available and secure websites and having them available to the providers.
Yeah, you're absolutely right, Nancy. And fortunately, within our healthcare system, even in our affiliate hospitals, they're all on e-record. They're all on electronic documentation. And so what had to happen in that framework was that we had to really be able to make sure all of our providers knew how to document a telehealth visit. And so in our e-record documentation, that all had to change. And then there had to be education around how to ensure that, that it was documented properly to get reimbursement, but also that there would be able to be that communication electronically.
There's a lot that's underneath the surface. It's like the iceberg.
Yeah, I know.
As a follow-up to that is, if we do something on my chart, with an extensive question to which an answer comes, does that get reimbursed?
No, there's no reimbursement for that at all. And that's really has been one of the draining parts of e-record, is that your providers are still supposed to respond to those in a relatively short period of time. And so a lot of us are doing that in the evening. They're seeing their patients all day long, and then they get to the my chart questions, and that's happening in the evening. So that has caused some weariness for providers being needing to be able to do that.
Yeah, thank you.
Mm-hmm. Good question.
One of the other things to add is almost 90% of our faculty continue to clinically practice. They're in some sort of a clinical arena. And Marianne Shaffrey, who is one of our pediatric faculty, but she's also has additional education as an ethicist, in ethics, and has done a lot of work in moral distress. And she really has been deployed to really be a resource for the nurses that really have had quite a different experience, and really being on the front lines and really helping them to deal with all the changes that have needed to happen, and to really see the impact of what's going on. And the hospital early on really stopped all visitors. We were already in that flu zone, where visitation was limited, but then it became that there were no visitors. So for nurses then, they weren't only the care providers, but they were also the family members, and really helping them to stay connected to their families, and really providing all that emotional support really took on a whole different level of need for the nurses. And so Marianne has been really running a lot of moral distress groups, moral support groups for the nursing staff.
That's so important. The old saying, you have to take care of yourself before you can take care of others. I think we all have experienced that and have had that cliche running through our minds at one time or another, but it's even more important now than ever, because I think people feel, at least what I've heard, I haven't actually been on the front lines myself, but they wish they could do more and feel inadequate that they haven't been able to do more, even though they're giving, 130%.
Right.
Other questions, comments?
I'll go again if I may.
Sure.
Your new construction expansion, is that on hold or is that going ahead?
Yeah, that was paused. That was probably the first time I got teary-eyed. So there's been many times since that. But that was also a very early decision. The university needed to make some decisions that it really affected all of us. And one of that was to put a hold on all capital improvement projects. And so, so those were all paused for 90 days. And we've already begun some conversations about when we can reconsider that. We were 1 week from starting. And it's really it's good that we never got started, because then we would have had to stop, because there was a New York State hold on all construction. So all non-essential construction was stopped anyway. So even though I will argue forever that it was essential, that in the eyes of the governor, it wouldn't have been essential. So we are now going to, from what I was told last week, is that beginning in September, there will be a month-to-month conversation from the university perspective about capital improvements. And so everyone is in agreement that, that the need to have a larger nursing workforce is more critical now than ever before. And so our building expansion will allow for us to increase our enrollment, as well as to increase the different strategies for education. And so I'm hopeful that October, November, that we will be able to start again. And we're all ready to go. So, and we'll make whatever, needed arrangements we need to make, for the building at that time. But so I am still hopeful that that'll take the place. And compared to the other capital projects the university and medical center were engaging upon, this is a very small project. So, so I'm hoping that we will get the go ahead for that in the fall.
Mm-hmm. Thank you for your question. I'd like to ask, what can we as alumni do to be helpful to the school?
I think being resources for our students and soon to be graduates is critical. They are, they haven't experienced anything like this before, right? And so, there's students that were definitely anxious, were very afraid for their own safety of having to go back into the clinical area. But the majority would email me and say, please let us go back. We want to be on the front lines. This is what we signed up for. Don't isolate us. We want to get in there. I kept saying there's rules. I can't. I have to make sure the clinical arena is ready for you. And so really supporting them just in conversations, because it is an anxiety-producing time. And some of us were reminiscing about what it was like when the HIV epidemic began, and how I was a new graduate when that started. And we never wore gloves before. We never wore any goggles. We never wore anything protective until HIV started. And that was really very frightening. I remember getting HIV tested 3 times because of the clinical situation that we were in, and didn't realize about the exposure and weren't protecting ourselves the way we had, we do now, and how frightening that was as a new graduate, thinking that, this job could literally kill me, that this, there's exposures that we never knew about. And so I think that kind of support for our students is critical, because they are entering a field that is ever changing.
So as a follow-up to that, because as we heard at the beginning, many of us don't live in the Rochester area. So how can we help from afar? Do you have any suggestions?
Yeah, I think that, there is, I know that the university has started, Andrea, help me out, it's called the Rochester Collective. Is that what, yes, that we'll be, sharing more information, where it is more of a mentoring program, a connection with students as well as with new alumni. And I think that's really helpful. Particularly since our students are all across the country, and it's helpful because I know a lot of our graduates. I know where they are, that I can link them up personally. But this Rochester Collective will really help to facilitate some of that.
Mm-hmm. Great. Any other immediate questions? I know. Oh, sure, please.
Hi, Beth.
Hi, Kathy. How are you?
Good. How are you?
Good. I'm coming from 2 hats, but for those who don't know me, I'm Beth Jamison. I graduated in 1984, and I'm currently a professor at Seton Hall University in New Jersey. But I'm wearing a hat of, actually, I was immunization coordinator in Monroe County before we moved to New Jersey, and then took on the realm of school nursing. I'm concerned about how can we advocate within our own communities to make sure that our schools are ready to open. I'm a member of the National Association of School Nurses, and we have created a white paper for that, but I'm worried about the rhetoric I hear from our policymakers and our legislators when they're on the TV news, and there doesn't seem to be a conversation happening in the media out there about how are we going to protect our students? What are we going to have in place? How can we make sure that like bullying and stigma is going to become huge, I'm sure, too, within school settings? And what can we do to be better as a collective group? I'm glad to hear that, to advocate for our youngest members of our society who need our help.
Yeah, you know, that is a great worry. I mean, that's very it's a very accurate worry. And you know, they only made, our governor only made a decision last week that schools would not reopen for the rest of the year. And in our own minds, we're thinking, why is that taking so long? There's no way these kids can go back to school this year. You know, there's no policies in place. You know, there's no, you know, cleaning. There's no way to socially distance them, right? And so I think so much education has to take place at the education boards. You know, we have the Rochester City School District Board, but every community has an education board that we really have to help educate them about the safety needs. Now, you know, our Monroe County Commissioner, Mike Mendoza, has been incredible. I'm sure, Kathy, you probably have, you know, worked with him in the past, but he's been quite an educator. And the county here is really, hold on a second, I just have a pop-up. The county here is in daily communication with our medical center leadership to help to guide them in some decision making. And so that is really key, to really be instrumental and be that resource for our schools as well as for the other community groups, and continuing to provide the education that they need to have. I can't imagine what that's going to look like in the fall of bringing kids back, because they don't have the luxury of having all different kinds of spaces for the students. And so, you know, I can imagine that there might be different times of the days that students go, and not having them all there at one time. You know, those are important questions. I don't have the answers to that. I do know, you know, we have school-based health centers that the School of Nursing oversees, and we actually kept those running even though the school was shut. Because, you know, we provide primary care to 80% of the students that are in the inner city schools, the two that we oversee. And so we kept them open for quite some time, and now it's really just, you know, on an appointment-like basis. But I don't know what thoughts you have, Beth. I mean, it's going to be a serious issue to bring kids back to school.
Yeah. Well, we definitely need capacity building, as we do in a lot of things that affect children. We don't have enough mental health providers that have focus in pediatrics as well. That's another issue, of course. But we also know that there are many places in our country that do not even have a school nurse in every building, where for some of us who are in the Northeast, that's like a no-brainer. Right. Everybody feels like—
we don't even have that in Rochester. We have nurses that rotate schools.
Yeah.
Oh my.
Right. So we have places where the school nurse, even if there's one school nurse in every building, is going to be super taxed in terms of like we're imagining things like the school nurse is going to stand at the front entrance when the students come off the buses with an oxygen thermometer to scan everybody's forehead. But then, you know, like, that's not the role of a school nurse. Right. You know, like somebody else could be doing that. Even the security guards are kinds of things. And they're not thinking in terms of, like, even a school nurse office, how closely confined students are. They come sit in a bunch of chairs in a waiting area, or, you know, and, you know, students, they're, you know, wiping their noses.
Right.
You know, are they going to keep their masks on all day? That kind of thing too. There's, you just, and what about all our vulnerable special needs children who are medically vulnerable? They can't be into school. How are they going to get the needs that they have now? I'm on a task force for trying to contact all the students with special needs who we haven't been able to get in contact with since school ended here in New Jersey, which was March 10th. And the parents don't answer their phones. We wonder what's happening with the child and child abuse. And there's so many things happening with children. And I'd like to see that conversation increase and improve more, so we can really make sure that they're safe. There's so many kids that we are so worried about that we have no idea what's happened to that child since they left the building on March 10th.
You know, we have a daycare for medically fragile children here in Rochester. It's called Daystar.
Awesome.
And you know, they have close to 50 kids from ages 4 months up until school age, till 4.5. And that had to close.
Oh my
And
goodness.
these were medically fragile kids that are there because they have trachs, or they have G-tubes, or they have other medical needs. And it really provides them comprehensive service with OT, PT, your early intervention, you know, as well as, you know, nursing care for that, you know, for, you know, an 8 to 10 hour period of time, so the parents can get to work, that they have some respite, really. And I sit on the board of Daystar, and that was a tough decision to close that. But it became a safety issue transporting them and having them have any exposure anywhere. And so that was a tough decision. But of course, we're now worried about all those kids that are now in the home that have all these medically fragile needs that do not have the supports that they need. And
No.
so, you know, it was really going to take, and, you know, we are doing that at some level right now, of that interaction between the medical center experts, whether that's nurse practitioners, nurses, the physicians, the social workers, and really having that connection with the county to be able to share in that burden. Because I don't think we have a clue yet what the impact has been, even in the realm of domestic violence. And the rise in domestic violence of being all sheltering in place.
Mm-hmm.
Yeah, I don't have an answer for you. I think that the importance is that we continue to advocate for what those needs need to be, and to be integral in some of the school boards to try to help them in making those decisions.
Thank you.
Yes, thank you for the question. Other questions, topics for discussion?
Well, this is Katie Votava. I don't know if
Oh,
you can hear me
Katie.
or not. Hi there. I sorry I couldn't get on the Zoom video. I'm actually, you know, multitasking, so the video was not going to work. Anyway, I don't have a question. I just want to say, particularly Kathy, as I listened to the opening and everything y'all have done in such a short period of time. I mean, wow, you knocked my socks off in terms of being able to turn on a dime. And yet we know we have miles to go before we sleep, but the creativity and dedication of the School of Nursing and yourself, and who early on said, Kathy's not a typical dean. Well, yeah, amen to that. So I just want to say thank you to everyone there at the School of Nursing.
Well, yeah, thanks, Katie. You know, and the, you know, I have the luxury of having an amazing team of leaders in the school, and people that work. I see Dee Dee's is on as well. That really, they never stopped, and they knew what we needed to do, and just jumps right in there. And you know, I feel so blessed that we have a team. And you know, I have obviously a Dean's Leadership Council that you know meets really once a month, and that's, you know, the leader of admissions and communications team, as well as our, you know, associate deans and directors. The associate deans and I meet all the time, but we were meeting once a month, and we changed that to once a day. We started meeting every day from 8:30 to 10 o'clock in the morning, and you know, really we're trying to delegate everything that had to be done. And everyone just jumped right in there. Yeah, I don't think we realized till about a month in how exhausted that we were. It was like we just there's no weekends, there's no evenings. I mean, we are just on at all times. And you know, in the same frame, you know, really trying to support our clinical colleagues, and really knowing what, you know, what was happening, and you know, it's been, you know, it's been heartwarming hearing all the messages, you know, about, you know, how incredible nurses are. And but there's part of me that and I actually share it in my message, my virtual message for the graduates, is that, you know, nurses have always worked in unprecedented times, you know, that we've always risen to the challenges. We've always been heroes in healthcare. And I'm glad we're getting that recognition during the Year of the Nurse, but it's always what we've done. And I'm not surprised by any of the activity that our nurses have done, because it's just what we always do. And so, I'm really glad that they're, that we're getting the recognition, during this time. But at the same time, this is who we are. This is what nurses do. This is what schools of nursing do. We've responded in emergencies all the time. And I'll tell you, I have not been surprised at all, but completely overwhelmed by the number of our students, faculty, and staff that, in addition to everything else they're doing, they're also volunteering. They're also, giving up their time and other activities and saying, send me somewhere else. I have 4 hours on this day. Can I go, to Monroe County and give out food? I mean, they're just looking for even more activities to do. I'll share with you that one of our students was having an issue with food insecurity. And the university opened a food bank just for our students to be able to access. And one of our staff had heard that the person really had run out of food that night and took food out of her freezer, chicken and some vegetables that she had, and packed it all up and drove it to the student's house so that she would have food that day. And, those are the kind of things that just, I'm not surprised about, because I know the people that work here and the commitment they have. But it is, always just a blessing just to continue to hear it. I mean, it is absolutely incredible the lengths that people have gone during this time.
Thank you. Very nice. I'd like to pivot just a little bit and open it up more to those of you online to ask you, if you want to share any of your experiences recently with COVID-19 or any other, how your Rochester school education has benefited you either recently or over time. We don't have a whole lot of time left, but if anybody wants to come forward, I think that clearly we all value the richness of the education we've received, even if it was a few years ago. It certainly stays with us, but this is a conversation, and so this is your opportunity if there's anything you'd like to mention to us.
So this is Phyllis. Hi, everybody. And hi, Kathy. I really have enjoyed these 45 minutes with the group. I was just doing a little private chat boxing with a colleague, and one of the things I said to her is, it's been a lot of years since I was a U of R undergrad, and a lot of years since I was in one of the nurse practitioner programs that was originally designed for faculty, and it was a 3-month wonder program. So, you look back on that and you think, isn't it amazing to see what that foundation has provided in a whole career that has followed since then? I remember the day I was standing in the office of the U.S. Surgeon General and thinking, oh my God, if they could see me now, or when I was at the United Nations and the same thing, or the World Health Organization. When I think about the doors that have been opened through both my University of Rochester experience and also my graduate experience at the University of Washington, I am very deeply grateful for the quality education that I got as a nurse, and it started at the U of R. And what was unique for me about the U of R was the incredible collaboration between nursing and medicine, number one, and between the medical center and the community, number two. I think it's still very much a model that a lot of other communities need to look at and look at very seriously. Seeing the public health crisis that we have been in, for me, just amplifies the need for healthcare professionals to keep taking a leading role in public health. It's not going to come from politicians. It's got to come from those of us in the health professions. And there's an amazing leadership opportunity on the table right now. I hate to think of why we have it. I think this pandemic has been horrific. But the other side of it, if there's ever, a bright side to this terrible problem, it has really showcased that nurses make a difference. They are advocates for patients, and they are wonderful members of the healthcare team. And if we don't leverage that right now to get what we need for telehealth funding in the future, for public health services for all, for changing the social determinants of health, then really we've lost a major opportunity. And I'd love to see Rochester and Washington and all of our other schools really take a major leadership role right now. And I know it's hard to do when you're trying to get through the day by day, but there is a leadership mandate right now that is pretty much unprecedented.
And, you know, I think too, with it being the year of the nurse and midwife, like we wanted to capitalize on that alone without any of this happening. So I think really combining the two, you know, it's really critical. I know that we're coming to the end, and I just wanted to, you know, to share that you know, in the midst of all of this, we lost Dr. Harriet Kitzman. And you know, when you think about the foundation that she laid for all of us in really just managing tough situations, and you know, we will be able to celebrate her life, you know, when we're able to get back together again. But I said that the gift that she gave all of us was that gift of calmness and wisdom. And I said, I try to channel her every day, you know, that, you know, this is something we can do. This is something we can manage. And you know, she gave 60 years of her life to the School of Nursing almost. Wow. And, you know, we try to channel that wisdom. But I think that is really, you know, what Harriet and Lee Ford have always done is have taught us is that you take that deep breath and you look upon your history and what foundation has been laid, and then you take it from there. And you don't have to start everything over again, because there's always that foundation that's already been laid there for us to continue to build on. And so I think for the U of R School of Nursing, we have that strong foundation of interprofessional education, you know, collaborative practice, you know, setting the bar for what leaders look like, and really working together to make that all happen. And so you're right, Phyllis. I mean, we have that foundation, and we need to springboard it even more so for this year.
Great. Well, thank you. That's probably a nice way to wind down our hour. It certainly doesn't seem like it was an hour.
I know.
Seems like, you know, 15 minutes, but thank you all for coming. I've been asked to give a little public service announcement reminder that obviously this is National Nurses Week, and that the U of R has an incredible School of Nursing alumni speaking panel called Nursing in Times of Crisis. And that is coming up this coming Tuesday, May 12th at 12 noon Eastern Time. And that will be closing out the week on Thursday, May 14th. So we encourage you to join, and there it is on the screen, you can see. And we'll talk about inequalities in the time of COVID-19 with School of Nursing Professor Natalie LeBlanc. So please attend, please register. And you can see the events on the 12th and then on the 14th. So again, it's been my pleasure and honor to host this hour, and I want to thank you, Kathy.
Thank you, Nancy,
for taking time. I want to thank all of you who took time, and to thank the crew that made it all happen. Jessica, Jolie, Andrea, Matt. As you said several times, that it takes a terrific team, it takes a village, and we all are one here. So thank you, and have a pleasant afternoon. Have a peaceful afternoon.
It's good seeing you. Bye-bye.
Bye-bye.